I want to ask everyone who comes to Lebanon to come and visit the border villages. These are not forgotten villages, and the Israelis did not occupy those villages until now. Inshallah, they will never occupy it. But everyone who comes to Lebanon, they should remember that this is a part of Lebanon, and I advise them to come and visit it despite the destruction. They will meet the people here, and they will have lots of spiritual energy from talking with those people who are living among this rubble, but refusing to leave their land and refusing to be intimidated by the drones that keep visiting the people here and trying to terrorize them and to make them escape.
Hey everybody, this is Laith Marouf from Free Palestine TV, and we are in Bleeda village, right on the border with Occupied Palestine. Before we continue with this program, I ask you to press the subscribe button on whatever social media platform you're watching this on, and to go to our website, freepalestine.video, to donate so we can continue bringing you this content. Behind me here, you could see the Houla Valley of Occupied Palestine, what used to be actually Lebanon before the French gave it to the British in 1932. And there is the occupation post of Bayad Bleeda. There's another occupation post right there. And we can see the Golan Heights and the wind farms on the Golan Heights that the Zionists have put there. Bleeda has suffered a lot, especially during the quote-unquote ceasefire, when the Israelis decided to destroy most of this village, and most of the villages in the south took advantage of the ceasefire. A lot has happened since then, but the city council of Bleeda has been working hard to make the village habitable again. There's a lot of efforts done now to do so, and we're going to talk to some of the locals, one of the local residents here, to tell us what their needs are and how they've been surviving since then. يعطيك العافية، كيفك؟ الحمد لله على السلامة، الله يقويكم ويحميكم. هذا بيتكم ايه؟
صحيح.
وانضرب خلال الحرب ولا خلال وقف اطلاق النار ما يدعى؟
لا، هيدا خلال وقف اطلاق النار، يعني بالشهرين اللي كانوا هن متواجدين فيه هون من بعد وقف اطلاق النار. ضربوه اول شيء، كانوا ضارب رجعوا حرقوه، ولعوه، يعني شو بدنا نعمل؟
ومن بس قد ايه صار راجعين انتم هلا للضيعه هون؟
نحن رجعنا اول يوم وقف اطلاق نار، كنت انا وخيي بالضيعه، فتنا كانت بعدها مدمره تقريبا، كان 90% من البيوت ما في شيء، ففتنا فتلنا وطلعنا، ما كان في اي مقومات للحياه، لا مي لا كهرباء لا طرقات، يعني حتى السيارات ما كانت تفوت لجوا. اضطرينا نوقف برات الضيعه ونفوت مشي. بقينا يوم يومين، وكانت تأس وقتها شتوية مثل ما بتعرفوا، لأنه وقفت الحرب أول السنة كانت بعدها شتوية. ففتلنا شوي، زبطنا شوي، رجعنا طلعنا، وهلأ مستأجرين هون بالضيعة قاعدين، نضلنا نجي نطلطل على البيت، نسترجع أيام الماضية والذكريات، والحمد لله باقيين بأرضنا، وما حدا بيخلينا نتخلى عن هيدي الأرض اللي راح شهداء كرمالها ودم. والله يكون معنا ومع الجميع ان شاء الله، مع الحق.
الله يقويكم. هلا بلشت البلديه تشتغل اعاده اعمار كهرباء مي. رايكم هل اذا رجعت كل الخدمات بيرجعوا اهل الضيعه؟
100%. ايه، هلا اول ما رجعنا على الضيعه يعني كان تقريبا في يمكن 10% سكان، يعني هي ضيعتنا ضيعه صغيره، يمكن سكانها بالالف الف وشوي، فكان البعض منهم موجود، بس صار يتأمن شوية خدمات، يعني هلأ صار في مي، صار في كهرباء، حتى جابوا موتور اشتراك. بدهم بعضهم ما عطوا الناس لأنه ما في العدد اللي لازم يكون، بس يكتمل العدد إنه مثل ما هن حاطين لبرسنج معين إنه يدوروه ويعطوا منه. هلأ تقريبا سكان الضيعة رجعوا 40%.
وإعادة إعمار أنتم عم بتواجهوا أي مشاكل، مثلا الجيش، التصاريح لإعادة إعمار، هاي في تضييقات عليها ولا كيف حاسين حالكم؟
هلا اجوا كشفوا يعني تقريبا كله بعضه على الورق، بس ما في اي شيء يعني، لا مصاري ولا شيء. بس انه نحن الشيء اللي اذا عم نظبط شيء عم بيكون من اموالنا الخاصه، عم بيكون من الناس اللي مسافرين برات البلد عم بيدعموا البلديه، يعني هيك. ما بس ما مش اموال مباشره من الدوله، كله بشكل غير مباشر.
وإن شاء الله تنعاد بليدة لأحلى وضع قبل الحرب، والله يحميكم. شكرا كثير على هالمقابلة.
كلك ذوق.
حاجة قديم كتقدم حاجة الحجارة قديم زاويتها ضيقة.
This was the historical mosque of Nabi Shu'aib. This is considered the oldest mosque in Lebanon. In fact, this was originally a Roman temple, then a Jewish synagogue, then a church, then a mosque. It is said to be at least 3,000 years old. And there was still the icons of Judaism and Christianity inside the mosque before its destruction by the Zionist forces that went into Bleeda during the ceasefire and blew it up. There's nothing left of it. Not the Islamic symbols, not the Jewish symbols, not the memory of Prophet Shu'aib. The amount of destruction is severe in Bleeda. At least 90% of structures are either totally destroyed or damaged in a way that is they are uninhabitable. 600 homes completely destroyed, another 500 that are partially destroyed. As you can see, this is the old neighborhood of Bleeda. There's a lot of homes that are made from rock instead of cement, and they're totally wiped off the map. According to the mayor of Bleeda, Hassan Hijazi, we're told 140 families have returned to the village of the around 400 that lived originally in Bleeda. We're going to go down to check on the clinic, and there's going to be a doctor that's going to talk to us about the rebuilding of the clinic and the situation of the medical services in the south. We'll go there right now. So we are in front of the graveyard in Bleeda. This is one of the graveyards that were destroyed, and the villagers managed to fix it up a little bit. You can see they put even a solar panel there to help the lights in the graveyard. But all of these graves were destroyed, and just like on the other side, the rest of the graveyard hasn't been fixed up yet. And the city, the village itself, Bleeda, is, as we said, 90% destroyed. We have with us special guest, Dr. Khalil Kusaybani. Mazbout?
Yes.
Did I pronounce it correctly?
Yeah.
And you are from the south, you are from the Nabatiya region, but you have served all over the south during the war. You stayed
Yes.
inside the area.
No, in Sur and Zahrani area. I was in hospitals between Sur and Zahrani region.
And obviously the south of Lebanon, much of the medical centers were targeted,
Yes.
the paramedics outpost, and even this clinic for Bleeda was targeted. Luckily, the City Hall have managed to fix up now the local clinic. Tell us, as a doctor that worked in the South, how important it is to have these smaller clinics beyond the hospitals, these smaller clinics in these remote villages. How much do they make a difference in such a situation?
Yes, if you want to encourage the local citizens, the people to return to their villages, you have to provide basic healthcare. So these primary healthcare centers are essential for the people. And it's not difficult. You can easily provide one doctor from each specialty, specific time of the week, one day in a week. He can check, they can provide prescription, chronic medications. But it's not only related to physicians. For example, what about the pharmacies? Lots of the pharmacies in these areas. Of course, we are speaking of the areas in the border. In further areas, no, the condition is better. But what about the pharmacies, and most importantly, what about the hospitals? For example, dialysis patients, cancer patients. It's not only about doctors. What about the Ministry of Public Health? What are they doing to encourage the physicians to return? For example, Laith, I was telling Hadi, one of the hospitals, without naming it, in this region, it's only performing surgeries one day in a week. Why? Because simply an anesthesiologist is only available one day in a week. Okay, what is the Ministry of Public Health doing? What is the Ministry of Finance also has a role, because it is responsible for paying to these hospitals, whether it is a public hospital or a private hospital. What are they doing to encourage physicians and staff? Even if you are a physician and willing to come, it's a team job. You have to provide the whole personnel to come. One of the main problems is that lots of the personnel, nurses and technicians working in these hospitals, they are displaced, their homes are destroyed. How can you ask them to come back and work here? Regarding physicians, yes, there should be better attempts, and not only from the ministries, local authorities. I was telling Hadi, lots of doctors who work in Beirut and in Saida, they are from these villages. Are there a real attempt and working to have deal with these doctors, facilitate their sometimes it's only the problem is with transportation. Mm-hmm. It's not that
the nearest
difficult.
Major hospital is in Bint Jbeil, right?
Unfortunately now it's not considered major. For example, 2 days ago I was in Jabal Amil hospital. We were contacted from Tibnin hospital. They want to transfer a case to Jabal Amil. So even the hospitals not on the border like Tibnin, they are not able to operate some essential, for example, brain surgeries. Why? Because there are no specialists are available. So it's not only, we shouldn't only wait for the Ministry of Finance, Ministry of Public Health. Local communities, local authorities, municipalities, they have a role to provide basic essential needs for the local community to come here.
So yeah, this is, of course, they need electricity to run the clinic.
Basically.
And they've just brought in this generator. Inshallah, the Zionists don't target it, because the Zionists are targeting the generators whenever they're being brought into the frontline villages. But let's say somebody needs a surgery here in Bleeda right now. The nearest hospital that can do a surgery for them is?
Bint Jbeil, I think.
It is Bint Jbeil.
Yes.
So it's at least half an hour drive.
Yes.
So it's a very critical situation.
But still, I think the two hospitals in Bint Jbeil are far from regaining their basic occupation or performing basic surgeries. The same applies for Maisel Jabal, I think, Governmental Hospital. I heard that there are attempts to resume operating, but I think we're still very far away from regaining. So basically, no, the nearest hospitals in all the border area you are speaking either Sur or Nabatiya, unfortunately,
wow.
Which is maybe 1 hour
One
from
hour
here.
drive
Yes.
from here.
Yes.
So
Yes.
it's very critical for
Yes.
anyone that's still living in the village here. Their
Yeah,
life.
but it's essential. Like you are you want to regain electricity and water, you have to provide health care. Whether it's hospitals, it's medications, it's medical supplies, it's medical personnel. And it's the role, we shouldn't rely on NGOs or even ministries. Local communities should work, but definitely the Ministry of Public Health and the Ministry of Finance, they are their role. For example, one of the problems for facing this hospital, whether it's a private hospital or public hospital, lots of these patients here don't have health care. So basically when they are admitted and hospitalized, who covers them? The Ministry of Public Health. The Ministry of Public Health hasn't paid since 2 or 3 years, okay?
Oh.
Okay, so you are asking these hospitals to admit a patient, give him medication, medical supply. You pay cash for the trade suppliers, and after 2 or 3 years, we will pay you as a Minister of Public Health. It's inapplicable here. Some larger hospitals in cities, they can tolerate, but these hospitals here, they can't tolerate. So they have to be given priority, and this should be done from the Minister of Public Health and Minister of Finance, because they pay. I think these hospitals should be given paid monthly. They better know how to operate and give them this money, but they can't tolerate like bigger hospitals.
Well, obviously the Lebanese government hasn't been servicing the south of Lebanon even before the war.
Yes.
They have kind of almost abandoned it, and this is why there is the Islamic medical services of that are filling this gap.
Yes.
Prior to this war. Those services have been targeted again. Allah يخليك.
عليكم السلام. انترفيو
مش هاد بس عم نصور شيء كنا هون عن
العيادة رجعت
عن الخدمات اللي عم تصير بالضيعة.
استطلع رأيه اسمه
مدير مدرسة متقاعد.
ايه يلا
ناخذ منك مقابلة.
يلا.
حج أنت كنت مدرس مزبوط؟
كنت مدير مدرسة لمدة 42 سنة
هون ببليدة. شو صار في هالمدرسة؟
المدرسة هلا قبل الاحتلال الأول. هلا احنا فينا احتلال الأول يعني قبل 2000 من 78 لل 2000 كان في تضييق من العملاء من جيش لحد من إسرائيل، كان العدد عم ينخفض. بعد التحرير بال2000 بفضل دماء المقاومة والشهداء كبرت المدرسة وصارت مدرستين، متوسطة وابتدائية. بعد منها هلا بفترة الحرب الإسناد حتما مثل ما بتعرفوا تشردت العالم وتهدمت المدارس. احنا هلا
ضربوهم للمدرستين
3 مدارس، هذه واحدة هون، هدية شوفها هون، ووحدة تحت على الحد مركز البلدية، ووحدة فوق. عندنا 3 مدارس كانوا هاو مليانين بالطلاب.
وضربوهم بالحرب، ولما وقف اطلاق النار دخلوا هون بليدة ونسفوهم كمان.
لحتى هلا على صعيد المدرسة، على صعيد العمل الاجتماعي الاقتصادي، كروم الزيتون يعني عم تحارب كروم الزيتون، وتحت المرمى عينيهم جرفوها كلها بالجراف. اليوم في كرم لابني رحت اطلع عليه الزيتونة عمرها من رومي، احنا بنقول له رومي يعني من ايام الرومان، عمرها 3000 سنة او 2000 سنة. في طحين طريق وجارفين الزيتون كيليتو لطلعوا ما بيسترجوا يمشوا على الطريق العام، ما بيسترجوا، بيقصوا جرافة قدامهم وبتلحقهم الدبابة وبيطلعوا لحتى شو ما يكون قدامهم، بيت، تصوينة، زيتون، كله بيجرفوه. يعني هلا الحياة.
اخر سؤال على انت، لانك كنت مدير مدرسة، هلا العائلات اللي رجعوا هون ما في خدمات مدرسية، وين بدهم يروحوا؟
لا في خدمات مدرسية. هلا البلدية في عنا مبنى متضرر مش واقع يعني. هلا راح يرمموه واخذوا طابق بمدرسة عيترون، ولا بدهم ياخذوا الطلاب على يعني جناح اسمها مدرسة بليدة، بس البناء بعيترون، والفانات بدها تأمنهم البلدية، تأمن الطلاب يعني على حساب البلدية.
ما شاء الله. إن شاء الله كل شيء يرجع يتعمر ببليدة ولبنان وفلسطين يتحرر من الصهاينة.
عنا اللي هو عنا بيقولوا له مسجد بليدة، هذا مشهور.
نعم.
وبير شعيب اللي هو على الحد، هاو أكتر شيء أثري عنا يعني. بير شعيب إذا حضرتكم مثلا قارين القرآن أو عندكم اطلاع لما النبي موسى إجا بده يسقي الأغنام عفوا بنت النبي شعيب عمسها على بدهم يسقوا الأغنام. إجا النبي موسى زاروا للبير وعبوا لهم مي وسألوا أغنامهم. يعني بتصور من دور النبي موسى البير كمان تضرر. والمسجد مسجد كمان احنا بنقول له هذا مسجد كان عليه نجوم سداسية يعود إلى دور النبي سليمان كمان هدوه انتقاما يعني.
يا الله. واحنا عم نعرف المسجد هون بدنا نروح نشوفه ولا نسجل عنده. البير بنوصل له ولا ما بنوصل له؟
لا ما فيك بدك تنسق مع الجيش. هو على الخط الأزرق.
يا الله. ممكن. خلاص ان شاء الله المره الجايه بننسق مع الجيش نروح نشوفه. يعطيك الف عافيه والله يحميكم. الله يقويكم.
الله يخليك. الله يوفقك. الله يرفع كلمتكم للحق.
Khalil, Dr. Khalil, we were talking before the local sheikh stopped us to tell us his what he has. He wanted to talk to somebody clearly. He wanted to interrupt us so he can give his own, send his message, and we're glad to do that.
Yes.
But just before that interruption, we were talking about the needs of the locals and the health workers.
Yes.
And how the government is not delivering on those needs.
Apparently, it's clear. It's not on the agenda of this government anything related to the needs of all the South. It reminds us of the 60s. When they used to call Lebanon Switzerland. And not only the South, all the peripheries. I don't like the word peripheries anyway. Baalbek, Akkar.
Yeah.
So it's reminding us now of these days. But I think as part of, after all, I'm a southern Lebanese, Hadi, the same. I think as a local community, parallel to asking the government to take responsibility, especially the relevant ministries, Ministry of Finance, Ministry of Public Health. I think as a local community, especially, for example, a while ago, Bleeda, since we are in Bleeda, lots of the villagers of Bleeda are in Germany. So the local community has the great potential. And I think the local community can fill part of the gap that the government is not incapable as much as unwilling. Indifferent. And if we want to be more honest, maybe the government is happy to see this condition. It fulfills its agenda and its goals. So the local community has the ability, and hopefully we should have the will to fill part of the gap. And you see, like, lots of these villagers of the Bleeda returned, and they are living in basic conditions, solar panel conditions. So the villagers are willing to come back here, even if lots of elements are missing. But it's our responsibility, I was talking to Hadi, everyone, what his skills, his capabilities, to participate in this. It's for the benefit of all of us to help and facilitate the return of these villagers. It's our land.
Well, Dr. Khalil Kusaybani, thank you very much for being with us here on the ground in Bleeda. You have given a lot to the people of Lebanon and South Lebanon.
My pleasure, Laith.
In your time, in your duty as a doctor during the war. And inshallah, we will have a sit down with you to talk about that experience of health in one of our Wartime Cafe episode. Again, thank you very much.
My pleasure, Laith. Well,
we're standing in front of the new water pool reservoir for the town of Bleeda. We were told, obviously, the reservoir at the top of the hill was destroyed.
This is one of three reservoirs now rebuilt by the local municipality after being destroyed, of course, by the war, by the Zionists attacking everywhere in Bleeda. Of course, this is a good amount of water because right now there is no water supplies from outside the village to inside the village, and also it's the last days of summer, so usually of course it's more than this, but now this is what is supplying the village with water. And of course we're talking about 1/4 of the population of the village only living now in Bleeda, so and this is one of three reservoirs.
So the municipality of Blida, it seems, are a little bit more advanced than the other municipalities of the frontline villages in terms of trying to bring back services.
Most of them are trying, but of course it differs based on how much the dangers. For example, we went to Kfarkila. There is no way, they even targeted the municipality police car, and he was injured. They targeted the gas station. They destroyed everywhere in Kfarkila. Some municipalities cannot even return to their villages. In Ayt al-Sha'ab, for example, it's the same. In Dhaira, maybe it's the same. But of course, when the people can return, no one is staying outside their villages. The Lebanese people, especially the people of South Lebanon, they want to come back, even this destroyed village. You can, if someone came here, he will think that this is a ghost town, but actually 140 families are living in this town, despite the fact that most of it is destroyed. More than 90% is destroyed, either completely or partially destroyed.
We even met the family that are been in the diaspora in Germany for decades, and they're back here, they don't want to leave. This shows you the connection of the people of the land in South Lebanon, in Palestine, how much love people have for the land. And looking at these municipalities, the minute that there's a chance for them to rebuild, that they are rebuilding.
The municipality of Bleeda accepted also donations from, I think, Iranian donors also, from the Islamic Republic of Iran, and they accepted donations from other donors, and of course the Lebanese government is doing the least.
Yes, the least help is coming from the Lebanese government.
I want to ask everyone who comes to Lebanon to come and visit the border villages. These are not forgotten villages, and the Israelis did not occupy those villages until now. Inshallah, they will never occupy it. But everyone who comes to Lebanon, they should remember that this is a part of Lebanon, and I advise them to come and visit it despite the destruction. They will meet the people here, and they will have they will gain lots of spiritual energy from talking with those people who are living among this rubble, but refusing to leave their land and refusing to be intimidated by the drones that keep visiting the people here and trying to terrorize them and to make them escape.
Well, this was our quick tour of Bleeda. We spoke to a lot of the locals, and we hope that this information helps you all understand what's happening here. This is Laith Marouf and Hadi Hotait for Free Palestine TV. We ask you one more time to press the subscribe button on whatever social media platform you're watching this on, and to go to our website freepalestine.video to donate so we can continue bringing you this content. And until we see you next time, we bid you all a free Palestine and a free Lebanon.